Psychological disorders. So this chapter is going to give you a brief overview of many of the prominent types of categories of disorders and disorders that can exist. We will not be able to talk about every psychological disorder because there are so many. Before we get started, let's kind of talk about a little bit of the history of disorders. According to the 1962 Midtown Manhattan study, 50% of the general population at some point has some form of mental illness. We generally think that today that number is probably the same or even higher. So at least half of the population has some form of mental illness. When we look at this chart, we can kind of see what the presenting problems are when somebody goes in for treatment. If you take a look at the chart here, you can see that aphobia, mood disorder, and social phobia are the three disorders with the highest rate of people seeking treatment. That's because mood disorders and anxiety disorders are like the common colds of psychological disorder. Any mental disorder could be anything else that doesn't fit these categories. Here's another chart for us to take a look at. And when you look at this one, it tells you the prevalence of mental disorders related on just a general disorder or a serious disorder and countries of the world. Now, it's interesting when you first look at this chart because it appears as though the United States has more mental illness and serious mental illness than all other countries, followed by the Ukraine and France and Colombia, etc. Then when you get down here to countries like Nigeria and Shanghai, they are, 5%, less than 5% of their population with a mental illness. So you start to think about what could be the cause of that. And at first, it might appear that, well, there are just more people are freer in countries like the United States. But the truth of the matter is, if you think about these countries and these cultures in Nigeria and Shanghai, even though there's shame associated with mental illness in the United States, there's more shame in a lot of other places. So just remember, anytime you see numbers and a chart, that's based on what's been reported. We know that numbers could be higher than is actually reported from others. So when it comes to psychological disorders, we have to talk about first what an abnormal behavior is. This will help you know what is classified as a psychological disorder. A behavior is considered abnormal if it's non-typical. So that means it's dysfunctional. It's something that's not happening in everybody else's lives. It's socially unacceptable. That's a big one. If it deviates from societal expectations, then you are doing something that's outside the norm. And if it's distressing to the person who's exhibiting that behavior or the people around them, they can end up seeking treatment. Because sometimes people reluctantly go to therapy, not because they're upset about something, but because my mom doesn't like it or my spouse doesn't like it that and also if it's dangerous. A psychological disorder is, by definition, a syndrome marked by a clinically significant disturbance in a person's cognition, emotion regulation, or behavior. So it could be in any of those areas. A person could have flawed thinking, they could have difficulty managing their emotions, and they could have inappropriate behaviors or a combination of all three. The field of clinical psychology is the field concerned with the assessment, treatment, and prevention of maladaptive behavior. Most people who work within the field of psychology work in clinical psychology, but we know from previous discussions there are other areas as well. A long time ago, when people displayed symptoms of a mental illness, at first, people thought they just had spirits in them. That when a person behaved in a way that was considered abnormal, they had an evil spirit, and they needed to get that evil spirit out of them. After that kind of theory phased away, and people with mental illnesses were recognized as having a mental illness, they were often put in insane asylums, which were these hospitals that had terrible conditions. And around the 1970s and 80s, there was a move towards deinstitutionalization. And that meant we no longer wanted to keep people in insane asylums. Once people were taken out of insane asylums and being locked away and kept from their family members, many people decided to live on the street and not go to shelters, or they didn't have family members they could go back to. So that's why a lot of the homeless population might appear to have mental illnesses. The American Psychiatric Association is the branch or the governing body that devised our system for classifying mental disorders. And that system is called the DSM-5, or the Diagnostic and Statistical Manual of Mental Disorders. The manual has hundreds of disorders in it, and if it's not in the manual, it's not considered pathological from a psychological sense. Now, the DSM-5 or the DSM is updated on a regular basis as societal norms change. So does the DSM. Here are some of the goals of the DSM. It is a system for diagnosing psychological disorders. It's there to improve the reliability of diagnoses so people come to the same agreement on what's happening and make diagnoses consistent. It's important to remember that the DSM classifies disorders and symptoms of disorders, but it will not ever explain the causes or cures. That is what therapy is for. The latest edition of the DSM was created in 2013. It classifies disorders regarding neuroses, psychoses, and insanity, which is a legal term, not a clinical term. So you'll never see insanity in the DSM, although it's often used in court because it's a legal term for somebody who is psychotic. The insanity plea is used as a legal defense in less than 1% of all cases. It's successful in only, half a fraction of those trials. But those trials often receive a lot of publicity because people feel like, oh, that person is trying to get off from committing that crime. The DSM tells us that there are approximately 400 different disorders, and they're grouped into 22 different categories. A disorder is considered comorbid if it co-occurs with another disorder, and it could be two or more disorders at the same time. So a person could be suffering from depression and alcoholism, or bipolar disorder and borderline personality disorder at the same time. Here are some risk factors associated with having a mental disorder. Any type of life change, any type of stressful event. So the risk factors are on the left, and on the right side, there are some protective factors. These are some things you can do to reduce the incidence of mental disorders happening in your life. Things like exercising, being literate, having high self-esteem, social skills. So now let's get into talking about some of these disorders. Starting with depressive disorders. Depressive disorders have to do with extreme and inappropriate emotions. Rumination is the tendency to focus on, overthink, and talk about something that a person is going through. Women have been found to be 2 times more likely than men to experience depression starting as early as the teenage years. The reason for that, according to a research study in 2003, is that women are more likely to overthink or ruminate about their problems. Men want to get to a solution, women want to talk about it. Major depressive disorder is feelings of unhappiness for at least 2 weeks with no apparent cause. And we've already talked about depression being the common cold of psychological disorders, along with anxiety. So a person will not be diagnosed with major depressive disorder if they have not experienced feelings of unhappiness for at least 2 weeks with no apparent cause. That's the important thing to remember. If a person is grieving and they've lost somebody, that's a cause, so it can't be major depression. Seasonal affective disorder has to do with experiencing feelings of depression and sadness during the winter months. So seasonal affective disorder, I always tell students to think of the acronym SAD, S-A-D, because this disorder is based on not having enough sunlight, so you feel sad. So it's easily treated with ultraviolet light therapy. So a person can literally sit in an ultraviolet light therapy room and they will start to feel better. Or just going outside and sitting on the patio. So anytime a person has experienced cabin fever, they probably just need some sun. Persistent depressive disorder is chronic depression. It's having a depressed mood for at least 2 years without any incidents of major depression. And for young people, that's a period of 1 year without an incident of major depression. And at some point, 95% of patients who have persistent depressive disorder will later develop major depressive disorder. And it used to be called dysthymia, but in the DSM-5 in 2013, it was renamed persistent depressive disorder. That's why the research study referred to it as dysthymia. The second category of disorders are the bipolar and related disorders. These are disorders that involve periods of depression and mania. Mania is a feeling of high energy. It's a time when people might engage in risky behavior like overspending or over-sexualized behaviors. And there are different types of bipolar disorder. Bipolar 1, which involves depression and traditional mania. Bipolar 2, which involves depression and what's called hypermania, which is there's still feelings of high energy and happiness, but it's not as extreme as full-blown manic episodes and probably won't involve any risky behavior. And then psychothymic disorder are mild mood changes between depression and hypomania. Anxiety disorders, which are another common cold of disorders, are disorders involving intense anxiety and dread, uneasiness and uncertainty and fear. This is where a person thinks something awful will happen to them. Anxiety is a generalized feeling of fear and apprehension that could be related to a situation or an object. Anxiety is not considered anxiety unless it's also accompanied by increased physiological arousal. So like sweating, increased blood pressure, heart rate. There are 4 different types of anxiety disorders. We'll talk about all 4. A phobia is an excessive irrational fear and avoidance of a specific situation or object. About 7.8% of the United States population has a phobia. Phobias are not to be confused with normal fears. You should have your normal fears, but It's irrational to fear something that has never caused you direct harm. For example, people can be afraid of clowns, they could be afraid of pickles, of needles, of spiders, etc. There are tons of different phobias. Generalized anxiety disorder occurs when a person constantly has intense feelings of worry, inadequacy, oversensitivity, and they can't concentrate. Generalized anxiety disorder is called such because the feelings of anxiety are generalized to many different situations. It could be anything that causes the feelings of anxiety and not just one thing, like a phobia. Panic disorder is an anxiety disorder marked by minutes-long episodes of intense dread and worry, accompanied by those physiological symptoms like feeling of choking and chest pain and frightening sensations. Agoraphobia occurs with people who experience panic attacks. They may eventually try to avoid situations where they think a panic attack might occur. This is what can lead to agoraphobia, which is the fear of being in wide open spaces or crowds where they feel like they might lose control and panic. For example, let's just say you go into a grocery store one day and all of a sudden you start having a panic attack. So now you are avoiding grocery stores because you think you'll have another panic attack. The fourth category of disorders are the obsessive-compulsive and related disorders, and they include obsessive-compulsive disorder, hoarding disorder, and body dysmorphic disorder. Obsessive-compulsive disorder involves persistent, uncontrollable thoughts and irrational beliefs. Obsessions are the irrational thoughts a person has, and compulsions are the rituals, the things a person will do that will interfere with their life. For example, some people have a checking obsession. That means they constantly think that they left their door unlocked, so they always have to go back home and check to make sure the door is locked. Only about 2.6% of the population suffers from obsessive-compulsive disorder. Hoarding disorder involves distress that's associated with throwing away things. It is the persistent difficulty in discarding or parting away with things regardless of their value. So people who hoard can hoard anything, and it's often related to things that have happened in their past. Like, for example, if you didn't have much when you were a child, you might keep everything because now having things makes you feel more complete. Body dysmorphic disorder has to do with the preoccupation with one or more perceived defects or flaws in your physical appearance. It's something that may appear slight to other people. For example, it could be somebody who's like, oh my gosh, look at my nose. It's so crooked. And other people, they can't see that. A person who has body dysmorphic disorder might repeatedly check themselves in the mirror, and they're always thinking about it and comparing themselves to others. I think this is one disorder that social media has played a probably negative role in because of the constant desire to compare yourself to others anyways on social media kind of plays into what the disorder is all about. The fifth category of disorders are your trauma and stress-related disorders. This is a new category in the DSM-5, and it includes these 5 disorders: reactive attachment disorder, disinhibited social engagement disorder, post-traumatic stress disorder, acute stress disorder, and adjustment disorder. We'll talk about those. Reactive attachment disorder occurs when a young child doesn't have healthy attachments with their parents or caregivers. They struggle in maintaining relationships with other people. We know that this has an environmental, a nurture cause, because this happens with children who have repeatedly been in foster care and have inadequate social and primary support givers. So if you don't have the care you need when you're a young child, it's going to be hard for you to maintain relationships with others later. Disinhibited social engagement disorder involves culturally inappropriately, overly familiar behavior with strangers. Also has an environmental cause. It also involves children who have neglect, usually before age 2. That means they will go up to a complete stranger and they are very familiar with them, because children should have what's called stranger danger. Post-traumatic stress disorder is where a person who's experienced a traumatic event suffers severe and long-lasting after effects. Most people usually think of post-traumatic stress disorder involving people in the military, but it could also be with rape and assault victims, abuse survivors, and survivors of natural disasters, or anything that was viewed traumatic by the person. It could be a car accident. Only about 10% of women and 20% of men react to traumatic situations and develop PTSD. So the question always becomes, why do more men tend to develop PTSD? And it has to do with resiliency. Research has shown us that Holocaust survivors show remarkable resilience after their trauma because they've talked about their experiences and they are positive about their experiences. People who are very religious also tend to have less PTSD, and that could be because of resiliency and the desire to talk about what's going on. Acute stress disorder is similar to PTSD. It's actually the precursor to PTSD, where the symptoms of trauma occur within a month of the traumatic event. If they don't end after a month, it's considered PTSD. But after you've experienced a natural disaster or some type of trauma, we expect you to feel afraid for about a month. That's called acute stress, meaning you just went through something stressful. But after that month and it starts to persist, then it can be more of a problem. And lastly, an adjustment disorder occurs when you are having difficulty adjusting to some type of life change. It's probably the mildest disorder in the DSM. It shouldn't last more than 6 months. And it can be associated with increased risk of suicide if the person feels like there's no end in sight. Category 6 are your somatic, symptom, and related disorders. These are the disorders that present themselves physiologically. These are the people who go to their primary care doctor saying, I'm just not feeling good, but it's really psychological in nature. Starting with illness anxiety disorder, which used to be called hypochondriasis. This is a new term in the new DSM. These people go to their medical doctors, and the medical doctors can't find anything wrong with them. They believe minor issues such as a headache or an upset stomach are indicative of something serious, like a brain tumor or stomach cancer. Many people with illness anxiety disorder will do what's called doctor shopping. They will go around from doctor to doctor until they find somebody to diagnose them with something. A conversion disorder is also called neurological symptom disorder, and that's when a person's anxiety manifests itself in a physical way. This is when a person will report severe physical problems that have no biological reason. So doctors can't find a cause, but a person will suddenly say they're blind or paralyzed. Our next category are dissociative disorders. These are the disorders that movies are made of. These are the ones that have to do with disruptions of consciousness. Starting with psychogenic dissociative amnesia. This is where a person cannot remember things with no physiological basis for that memory disruption. This can involve retrograde amnesia, where they've had an accident and now they can't remember things, or it could be organic. It could involve both retrograde or anterograde amnesia, which is after an accident. So a person with dissociative amnesia just has trouble remembering things in their life, and doctors can't figure out why. Dissociative fugue has to do with people finding themselves in unfamiliar environments. Like they might end up in Arkansas and have no idea how they got to Arkansas. It's because they believe there's a split in their personality. Dissociative identity disorder, probably the most popular dissociative disorder that movies are made of. It's also called multiple personality disorder. Is when a person has more than one personality living inside of them. So you have the host, who is the person who you know and who that person looks like, but then that person may have many other personalities living inside of them. Many people with dissociative identity disorder have a history of childhood abuse and trauma, and those other personalities were created in a way to protect the person from harm. The Hospital Timberlawn in Dallas used to be a big treatment center for dissociative identity disorder, but it has since been shut down due to some serious compliance issues. Category 8 are the feeding and eating disorders, which are anorexia nervosa, bulimia nervosa, binge eating disorder, and pica. They account for various percents of the population's disorders, and we know that genetics and environment can play a role in these disorders. Starting with anorexia nervosa, which is characterized by excessive weight loss and self-starvation, a preoccupation with food, anxiety about gaining weight and being fat. And it mostly happens in the early teens and mid-20s. Bulimia nervosa has to do with eating large amounts of food uncontrollably. That's what a binge is. And then getting rid of that food through the use of vomiting or laxatives or exercise. There's a preoccupation with body weight and can also involve depression and mood changes. Binge eating disorder, also known as compulsive overeating, is bulimia without the purging. So it's eating beyond the point of feeling full, having feelings of shame and self-hatred after a binge, struggling with symptoms of anxiety, depression, and loneliness. And a person's body weight can vary from normal to mild to moderate and severe obesity. When people binge eat, they binge eat the foods that have the highest calories. Most people aren't binge eating salad and fruit. And lastly, we have pica, which is the eating of substances that have little or no nutritive value. The most common types of things people eat that don't have nutrition are starch, ice, dirt, and clay. Personality disorders have to do with 3 different clusters of disorders that people can have, which can impact their ability to function, but I want to be clear, cannot be cured. Personality disorders can only be managed, and they cannot be diagnosed before age 18 because obviously you're still developing and growing into who you are before 18. Starting with cluster 1, which are the odd and eccentric personality disorders. This includes schizoid personality disorder, and people with schizoid personality disorder like to avoid relationships and don't show much emotion. They generally prefer to be alone and don't secretly wish for popularity. These are people you might consider loners. Doesn't mean they're criminals or thinking bad things. They just like to be by themselves. Might prefer a career where they work alone. Schizotypal personality disorder are people who also have a need for social isolation, but they can also have odd behavior and thinking. They might think they have an extra sense, an ESP. Many people think of schizotypal personality disorder as a mild form of schizophrenia because of the odd behavior and thinking. And then paranoid personality disorder involves a distrust of others and constant suspicion about people around you, that they have sinister motives. People with this disorder are quick to challenge their loyalties with friends or other people's loyalty to them, and they might shift blame to others and carry lifelong grudges. But that persists within their personality. Cluster 2 disorders are your dramatic and impulsive disorders, your attention seekers. Starting with antisocial personality disorder, who most people like to call sociopaths or psychopaths. These are people who lack empathy, have little regards for other people's feelings. They might commit crimes and look at the world as a hostile place. Histrionic personality disorder is somebody who needs to be the center of attention, whether it's through dressing provocatively or dressing silly. And I'm not saying like Lady Gaga has histrionic personality disorder, but just think back to when she first started being a singer. If you're old enough to remember, she often did these things that were sensational to grab attention. People with histrionic personality disorder always behave like that. It's not just for attention one time or to get your music career started. It's because that's who they are. Narcissistic personality disorder has to do with having an unwarranted sense of self-importance, thinking that the universe is centered around you. Somebody else might talk to you about their problems and you saying, well, what about me? Or I did this, even though somebody was sharing something of importance. And borderline personality disorder, which has to do with an inability to maintain interpersonal relationships with others, impulsivity, and people who have no sense of who they are. They can feel very empty. They can see themselves as all good or bad and can be very needy and have an abandonment fear. And cluster 3 are your anxious and fearful personality disorders, starting with dependent personality disorder, which has to do with somebody who depends on the help of others with making decisions and doing anything. Avoidant personality disorder occurs when people prefer to avoid social situations because they fear they will be ridiculed or humiliated. So they want to avoid being around others. They feel themselves are as socially inept or personally unappealing, so they just want to avoid it. And obsessive-compulsive personality disorder is characterized by inflexibility, rigid conformity to rules, perfectionism, and orderliness. People with obsessive-compulsive personality disorder stress perfectionism and feel anxious when things aren't right. So this is different from obsessive-compulsive disorder. People who have obsessive-compulsive disorder are having thoughts that cause them to engage in behaviors. People with obsessive-compulsive personality disorder are like perfectionists who are inflexible in their thinking and have a desire to be right. This guy is cutting his grass so that every strand is the same length. He's trying to be a perfectionist. And the last type of disorder we need to talk about is schizophrenia and everything associated with the disorder schizophrenia, which means split mind. Only about 1% of the population suffers from schizophrenia. It involves disorganized thinking, disturbed perceptions, and inappropriate emotions and actions. Disorganized thinking has to do with having bizarre thoughts and false beliefs. It can come from a breakdown in selective attention, not being able to filter out incoming information. Delusions are false beliefs. People can have delusions of persecution, like people are going to harm me, or delusions of grandeur, like I am God or I'm a person who is important. People can also have disturbed perceptions, which are hallucinations, and that means they can see or hear things that aren't really there. People with schizophrenia can also have inappropriate emotions and actions, such as laughing at inappropriate times. They may not show a facial expression, which is flat. It should be affect, A-F-F-E-C-T. They could engage in senseless compulsive acts and catatonia, where they don't move at all. Positive symptoms of schizophrenia have to do with those delusions and hallucinations, something being there or assuming something is there when it's really not. And then it can also involve negative symptoms, which is the absence of emotions like affect. Schizophrenia is usually something that's not diagnosed in males until the early 20s and in females in the early 30s. I know that's a lot, but that's everything you need to know about psychological disorders.